Welcome back to Champions of Care, brought to you by Oakwood Healthcare. Today we're talking about healthy pregnancies. And sometimes, no matter if you do everything right, a woman can have a high-risk pregnancy. Here with us today to talk about that is Dr. Sara Garmel. Dr. Garmel, you're a maternal-fetal medicine specialist specializing in high-risk pregnancies, and you practice in Dearborn. What are some of the causes of what we call high-risk pregnancies?
Well, high-risk pregnancies mean different things to different people, but the most common reasons we have patients come to our practice are diabetes, hypertension, preterm deliveries, and multiple pregnancies, triplets and quadruplets.
Triplets and quadruplets are often found in an ultrasound, isn't that correct?
Yes.
And I understand you've brought with you some ultrasound images to help our viewers understand what an ultrasound is. So what are we seeing here, Dr. Garmel?
This is a picture of a face. If you look closely, you can see the nose and the upper lip, the lower lip.
Oh, wow. Look at that. Oh, it's real obvious there.
So this would be an important view to rule out a cleft lip, for instance.
And how old is the particular baby in this image?
This fetus is 32 weeks along, and we're doing a survey just to make sure that there's no growth abnormalities or structural problems.
Now, a lot of us think that an ultrasound is used strictly for determining if the baby's going to be a boy or a girl, but there's a whole lot more you can see in that.
Much more, much more.
Do you, can we take a look at the baby's spine?
Sure.
Oh my gosh, is that it right there?
Yep, that's the cervical spine that we're looking at here, and then we'll track the baby's spine down all the way to the tailbone to make sure there's no defects in the spine.
That is just an amazing technology. That must be quite a tool in your arsenal for high-risk
Absolutely.
images. How often might a high-risk patient have an ultrasound through their pregnancy journey?
That depends on the actual diagnosis. So for instance, if it's a patient that's coming in with twins, say, we'll typically do one every 2 to 4 weeks, depending on the gestational age. If it's someone that has a baby that's very small, we may do it a little bit more frequently than that, just to make sure the baby is active and healthy. So we do need to individualize.
A lot of women get that snapshot of an ultrasound and they carry it around and post it on their desk, but you have quite a lot of images here, including the heart. Is that correct?
This is the heart. You can see a nice strong heartbeat. It's in the normal range, just eyeballing it. And then we'd want to make sure that the chambers are put together correctly, that the vessels are correctly oriented. And there's no fluid around the heart. You can see the baby very active. This is a very healthy fetus.
Wow, that is wonderful. And how old is the fetus we're looking at here?
This is 32 weeks along.
32 weeks. So if you're going to have a high-risk pregnancy, no woman plans that, but it's good to know there are specialists like you, Dr. Garmel, who can help chart the course through those waters. Now, sometimes a high-risk pregnancy means the baby, once born, will need special care. So that teeny tiny baby may need to go into a neonatal intensive care unit. Oakwood Healthcare happens to have an extraordinary neonatal intensive care unit, or NICU as we call it. We're going to take a look at that NICU unit right now.
Preterm delivery, by definition, is somebody who delivers before the 37th week of gestation. The majority of those babies are going to be 34, 35, or 36-week gestation infants and don't come to the NICU. The children of greatest concern are the infants born less than 1,500 grams, or approximately 3 pounds 10 ounces. Those children will end up in an NICU, and they are at high risk.
Approximately 400 babies come through the NICU at Oakwood Dearborn per year through either internally or external transports. We see 1 out of 10 babies who are very low birth weight, which is 1,500 grams or less, and those are the babies who are at highest risk.
It's a tight-knit group. As an entity, the nurses, the nurse practitioners, and the physicians work together very well as a team.
We enjoy each other's company. There's a lot of camaraderie and collaboration, and we just love what we do, caring for the critically ill babies and seeing the progress from admission to discharge. It is just such a rewarding experience. We're working on decreasing central line infections in our unit. We limit line interruptions. We use a chloro scrub when we're dealing with the ports. We wear hat, masks, and gloves when we're handling the lines. And now we're no longer wearing jewelry below the elbow. We collaborate together, we respect each other, and that is the key to success.
Oakwood is a great place to have a baby. We are a front runner in the OB Keystone project with the Michigan Health and Hospital Association. We have an excellent core of physicians, nurses, nurse practitioners, other providers. It's a great team. We deliver the 3rd highest number of babies in the region, the 4th highest in the state, and that's not an accident. That's because people choose to come to Oakwood to have their babies.
Our son Lander is 2.5 right now. He was born 8.5 weeks early, and he came into this world weighing 4 pounds, 5 ounces. And our son Logan is 1.5 years. He was born 10 weeks early, and he weighed 3 pounds, 5 ounces. Since Lander was our first child, I was so scared because I just wanted to make sure that we were going to have a healthy baby for our first child. When my water did break, I was scared, but I knew that the NICU was right down the hallway and that our son or daughter would be put into the best hands possible when they entered the world. Logan, my pregnancy was off to a great start. I was feeling fine. I kind of knew what to expect because it was our second child. But with Logan, it was a lot scarier because at 23 weeks, I started having complications. Lander only stayed in the NICU for 16 days. Logan stayed double the time, 32 days. And we were able to keep Logan home with us for 2 weeks. And then something just wasn't right. He stopped eating one day, and he was just really lethargic. I noticed a little red mark on his right below his ear. So we took him into the emergency room, and it was then that I experienced a parent's worst nightmare. We lifted the blanket up over his head on his car seat. He was completely yellow, and I saw a nurse flying around the corner, and she just ran with him, and all she kept saying is, "Breathe, baby, breathe, breathe, baby, breathe." It was the worst moment of my life, but it's something about that NICU team because even during the darkest times of your life, there's a light. Even though I didn't know if we'd ever hold Logan again or take him back home, I knew that the NICU team and the doctors at Oakwood Hospital do all that they can to provide the very best care for your sons, and that's exactly what they did for Logan.
The most rewarding part is when babies get to go home. When I was in my residency, the NICU wasn't necessarily a terribly positive place to be. Now it's unusual to see a baby celebrate a 100-day celebration. So babies are getting home healthier, sooner, and that's what we like to see here. Since I've been here at Oakwood, I know that I've been involved in the care of over 5,000 babies, and that's very rewarding to know that most of those babies went home.
Lander, he's active, he never sits down. He doesn't stop until 7 o'clock when it's time for a bath and his books, and he's ready for bed. Logan is amazing. I think he kept tabs on Lander every time that he picked on him because he fights like an older brother. But Logan follows in Lander's footsteps. Whatever Lander does, Logan wants to do the same thing. When you look at them, it's so hard to believe that they came into this world so early and they were so small and helpless. And today you would never even know that by looking at them. They're 2 active little boys that keep us on the go. There's not a day that goes by that we don't think about you guys. There's not a night that ends with us thanking God for putting you in our lives. We can't thank you enough for standing by Lander and Logan's side, especially Logan when he had to fight a little bit harder. And I just want to thank you for being the first heroes in Lander and Logan's lives. You'll never be forgotten.
Dr. Garmel, it's great to know you and the Oakwood NICU are working hand in hand for high-risk pregnancies and little tiny babies. Thank you so much for being here.
Thank you for having me.
I also want to thank Dr. Shari Maxwell, Dr. Carol Baker, the good folks at the Oakwood Annapolis Birthing Center, and all the team at the Oakwood Hospital Neonatal Intensive Care Unit. For more great health information, go to oakwood.org and find this show and all our other Champions of Care programs. Thanks so much for tuning in.